I did my undergraduate degree at McGill University in Montreal, Canada, where I'm from, and then I moved south of the border to attend Dartmouth Medical School, where I completed my MD and PhD degrees before moving out here to California to do my residency program in anesthesia at Stanford. I was lucky enough to take part in the FARM program, which is the Fellowship in Anesthesia Research and Medicine, which is a program focused on residents who are interested in academic careers in anesthesiology. As part of this program, I participated in 9 months of research during residency and then stayed on to do a year of research after, spending 25% of my time in the operating room and 75% of my time doing research. In my spare time, I enjoy hanging out with my children and eating sushi with my family. The wonderful thing about our department is there are actually several ways that residents can participate in research. One is the FARM program, of which I'm a graduate and now the assistant director, and the second is through residency research rotations, of which I'm also the director. The first one, FARM, is really aimed at those who are interested in making research a large part of their career. What it does is it offers residents 9 months of research during residency, followed by 1 to 2 years of research after, at which they act at an attending level in the operating room and continue their research as a postdoctoral fellow in the lab. The second way is through the residency research rotation. We usually have about 8 or 9 residents who participate in that program every year. And what it allows residents to do is spend 1 to 2 months doing research every year. And they pair up with a mentor, usually somebody who already has a project ongoing in the lab or a clinical project or an education project. It really doesn't need to be lab-based. And they spend that time working with their mentor and putting together an abstract for one of the small conferences called WARC, the Western Anesthesia Residence Conference. And it's a really great opportunity for those residents who want to get involved with research to get their feet wet. The FARM program, we usually have fewer residents who participate on it because, as I said, it's very specific to those who want to make research a large part of their career going forward. So we often have 1 or 2 residents only participating in FARM at any given time. If I were to give advice to residents interested in having an academic career, I would say that it's not easy to be both a physician and scientist, but it's extremely important. Sometimes you feel like you're not in the operating room enough to be as good as your full-time clinical colleagues, and you're not in the research realm enough to be as good as your PhD-only colleagues who spend a lot of time there. But there's a lot of value to understanding both languages. Physician scientists can take a more translational approach to basic research, and they can take a more clinical approach to basic science questions. So while it's hard to juggle both, bridging that gap between the clinic and the research realm is key to moving our field forward.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.